Good afternoon, it's Dr. Malik Rahim again. Let me briefly talk about part two. And part two is how do you actually create a treatment plan? There are so many different resources out there how to create a treatment plan. Um, but I want to go over this checklist that I think is really good. And the checklist breaks down treatment plans into five sections. Um, the problem statement or presenting problem, the goals, the objectives, the interventions, and the general checklist. The general checklist items are presented usually as follows. Okay. When you come to the problem statement or the presenting problems, do problem statement reflect the six problem domains? And the six problem domains are medical status, employment and support, drug and alcohol use, legal status, family social status, and psychiatric status. Are problem statements written in behavioral terms? Are the problem statements written in non-judgmental and jargon-free manner? And are the problem statements based on priority? You also want to look at what does the client want to achieve during the counseling. And this is when you look at the goals. So do the goals address the problem statements? Are the goals attainable during the active treatment phase? Would the client be able to understand the goals as written? Would both the client and treatment programs find these goals unacceptable? Has the client's stage of readiness to change been considered in the goal statements? And so these are the things you want to look at and answer as you're creating your treatment plan. When you look at the objectives, you want to look at what will the client say or do. Under what circumstances will this occur? How often will they say or do this? Do the objectives address the goals? Are they what we call SMART goals, right? Are the goals SMART? And the SMART is the acronym for specific, and are the specific activities included? Could the client understand what is expected? M, measurable. Can change or progress toward meeting these objectives be documented and or evaluated? A, attainable. Can the client take steps toward meeting the objectives? R, realistic. Can the client meet the objectives given their current situation? And finally, T, time limited or timely. Is the time frame specific for the objectives? So those are the things you want to look at. When it comes into the interventions are what will the client do with the counselor to achieve these things. So what is the counselor going to do to help the client? And then under what circumstances? Do interventions address the objectives? Then you look at, are the interventions SMART? Using the same acronym, right? S for specific. Are specific persons responsible for assisting the client and providing the service? M, measurable. Will the counselor or treatment program be held accountable for the services? A, attainable. Do interventions reflect the level of care available, or are outside referrals used when needed? R, do the interventions reflect the level of functioning or functional impairment of the client? And finally, T, time limited, timely. Is the time frame specific for the interventions? So when you come to the general checklist, some of the things you want to look at is is your treatment plan individualized to fit your specific client based on their unique abilities, their goals, their lifestyle, their socioeconomic status, their work history, their educational background, and culture. Or you can look at it as the respectful model, right? Second thing you want to look at is, are the client's strengths incorporated into the treatment plan? Because a treatment plan should be strength based. Has the client and significant others participated in developing this treatment plan? So you want collaboration so the client can feel a part of ownership with that treatment plan and the goals that's going to be achieved and the objectives, right? So you want them to buy into it. You want them to have some kind of ownership. And is the plan dated and signed by all who participated in developing this treatment plan? So those are things I would encourage you to look at when you're looking at treatment planning.